Hello and welcome to the Complex Care Journal Club podcast. My name is Kathleen Huth. I am a pediatrician at Boston Children's Hospital and your host for this episode. In this podcast series, we seek to discuss emerging evidence in the care of children with medical complexity and its implications for practice. I'm delighted to have Dr. Kate Nelson from the Hospital for Sick Children in Toronto, Ontario, joining me today. She is the senior author of the article, Learning to Trust Yourself, Decision-Making Skills Among Parents of Children with Medical Complexity, published online in Journal of Pain and Symptom Management in May 2024. Kate, thank you so much for being here.
Thank you so much. I really appreciate it. I'm excited to be part of this conversation today.
We'd like to start off by asking you to share a little bit about your study, starting with the gap that you identified and your study aims.
We know that caregivers of children with medical complexity face many challenging medical decisions about their child's care over time, and that there was reasonable evidence to show that parents of children with medical complexity, as well as other patient groups who experience multiple decision-making events, actually change the degree to which they engage in decision, how people actually interact with clinicians and how they partake of shared decision-making changes over time. But there hadn't been a lot of work done to figure out, what are the things from a parent's perspective, what are the skills that they've learned that allow them to change that engagement. And so the goal of this study was to understand from parents' perspectives, what changes for them? What did they learn about decision-making through experience, and how does that influence how they now think about decisions that they're facing for their child?
I love that idea of hearing from the parents themselves what that process looks like. Can you tell us a little bit about the methods that you chose to study this?
We used interpretive description, which is a qualitative methodology that tries to understand a healthcare phenomenon by looking at patterns in people's lived experiences. We did semi-structured interviews with caregivers of children with medical complexity who we recruited from two large Canadian pediatric hospitals, so Alberta Children's in Calgary and SickKids, or the Hospital for Sick Children in Toronto. Coming into the interview, we asked them to think about two decisions that they'd made that they thought were particularly challenging, one around the time of their child's diagnosis, and then one more recently. And we asked them to then tell us the story of those two decisions and then compare and contrast their approaches to the decision-making and tell us, more concretely, what were the things that they learned along the way that changed what they did in their more recent decision-making experience.
What were some of your key findings?
Parents really described 4 different areas where they built specific skills. First, they became more adept at managing decision information. So they were able to know better what questions to ask and how to effectively seek out answers to those questions, whether they were seeking out those answers within members of their child's healthcare team or within a larger community of other parents or on the internet. They learned about the influence of a decision's context. This one was the most interesting to me. Parents started to realize the patterns in what would make a given decision harder or easier. And if there was a lot of clinical uncertainty, they recognized that the uncertainty itself made the decision feel harder. Similarly, like when they were, if their child was facing a completely different medical problem than they had experience with before in the past, so it was an area where they felt less knowledgeable, that would also make it feel harder. Similarly, like things that were more urgent or that were happening in an inpatient setting compared to a decision that needed at home. All of those features changed the experience of making the decision, irrespective of the decision itself. Then third, they discovered the importance of their relationships with providers. They talked a lot about when in the early decisions, feeling this real power differential between the providers and themselves, in part because they didn't yet know much about their child and their child's medical condition, and that as they had more experiences and as they learned about their child and about their child's condition, their relationship with providers changed. And that there were particular providers that they felt that they developed a really strong partnership with, and that they would then be able to engage with those providers differently. And they had certain providers that they would particularly trust. Actually, many of the families talked about the importance of their complex care team members as that person that often people tell me that I should do things for my child and I don't listen to them. But when it's the complex care NP, that knows me so well and knows my child so well, and when that person says, this is really important, I pay attention to that in a different way. And then finally, they learned how to become more effective as a decision maker. When people are asking you these questions about your child when you're a new parent, you don't even know where to start or what it even means to make a decision for your child. But over time, you sort of develop intuitions about what's important to your child, what's important to you. You learn how to advocate. One parent said, I realized at a certain point that no one else is going to advocate for this child the way I have to. Everyone is doing the best they can, but to nobody else is this their whole world, which I thought was really a beautiful way of encapsulating this unique sense of responsibility that parents told us they felt about these decisions, and how that sense of responsibility sort of led them to feel like they needed to be their child's voice. And then finally, many parents talked about how early on they would focus only on the decision itself. They saw physiologic implications of this decision. But over time, they learned to actually incorporate a much broader view of what does this decision mean, not just for my child's physical health, but for other aspects of my child's quality of life or things that are important to my child. And what does this decision mean for my family? Doing this path, how would that change our family life? And taking in that wider lens into consideration as they made their decisions. I think then the last thing that we learned is that parents really tied learning skills in these areas to their own sense of confidence and agency. They really said, as I learned this set of skills, that's what made me feel like I was better as a decision maker. A parent told us, I feel confident that I know what we're talking about now. I know the decisions I'm making are smart and thought out, but they're still scary. And to me, that actually is really important too, that even when parents had this set of skills that let them feel more comfortable making decisions, it wasn't like they were actually comfortable sitting with the outcomes of the decisions and the weight of the decision, but that they had a set approach that allowed them to feel less overwhelmed in sitting with those challenges.
Thank you for summarizing those findings in your 4 themes so beautifully, including some of the specific voices from the parents. I think the things that struck me as I was reading through the paper was that 3rd theme about the role of relationships with their care team and just the profound influence that can have on the decision-making and care experience. And then really the role of trust and how that develops over time with a team. And the fact that your paper is generating that awareness of the important role that plays, I think is really powerful. And then that last piece that you were speaking to about families developing this sense of agency and confidence, I think the corollary to that I was kind of reading between the lines was that families were expressing that maybe their opinions on the best approach wasn't always valued early on. And I'd love to talk to you a little bit more about some of your perspectives on what we do with that information and how we can improve our approach.
This was one of my real takeaways personally from doing this study, was hearing the stories of the early decisions was really hard because the parents really highlighted the degree to which they felt disoriented. They felt like they would be woken up in the middle of the night and asked to make an urgent decision, and they didn't feel like they had any personal space or any agency in saying, this isn't a good time for me. One parent talked about being in the NICU and having this large team of people come in and start telling her about this decision. And she was like, I felt like I didn't have a choice. I didn't have a voice because it was all of these people and they were all in agreement. And I was just this mom. And she felt like she was sort of coerced into making this decision. She just heightened for me the fact that for us as clinicians, the hospital is a very normal environment. I know what to expect. It's the comfortable place for me to be, right? I know when things are going to happen, and there's a whole structure of a hospital that's familiar to me. And the degree to which I think many families highlighted that early on, they're not only trying to make this really difficult decision and scared and overwhelmed, but they're doing this in a place like they don't know the rules. They don't know if they can say, can I go brush my teeth or have a glass of water before we have this conversation? They don't know what's okay for them to advocate for or what's not okay. And so they're both sort of trying to understand this entire place as well as trying to make these really difficult decisions with time pressure. So that was that perspective shift for me. I think there was a time when I was a trainee and I didn't know what it was like in the hospital. And I spent a lot of time like paying attention to like, okay, how does this work here? But I hadn't really fully realized the degree to which parents are, of course, having that same experience. But it's been so long for me, I'd forgotten.
A lot of the study was talking about skill building on the part of parents, and they've learned so many ways to adapt and pick up on all those cues from an environment that's unfamiliar. Thinking a bit more about the skill building piece on the part of clinicians who may have lost that sense of what it means to be in someone else's shoes early on in an unfamiliar setting, and some of the opportunities there might be to build that awareness and skill set for members of the care team as well for the decision-making process.
Exactly. I think that as clinicians, recognizing that it may be helpful to give parents permission to say, is this a good time? Or is there anything that you need to do? Like, do you need 5 minutes? Can I come back? Because I think that often I just happen to come to this room at this moment to round. I could come back, and just verbalizing that or helping explain what the context is, especially when it's maybe unfamiliar.
In hearing the families' stories and their experiences with decision making, you started already speaking to some of the implications that we can take away in terms of clinical practice. But what would be some of your other recommendations for members of the interprofessional care team for children with medical complexity based on these findings?
One of the biggest takeaways for me is that many of the parents actually told us how helpful this conversation was for them. They said, I never stopped to think about how much I've learned. I'm so deep into the experience of caring for my child that I hadn't stopped to reflect, and that this was actually really a valuable experience for me to actually articulate the things that I've learned along the way and the ways that I've changed, that they felt that this had helped them see things differently than they did when they went into the conversation. And it made me realize the degree to which we don't always help people take that step back. And I wonder if clinically, for those of us that are clinicians, if that's an important opportunity to actually just help parents stop and step out of the minute-to-minute decision and really conceptualize, what are the skills that you already have, even if you've never made a medical decision before. Like, have you ever faced a difficult decision? Thinking about how can you leverage the things that you already know, and doing a bit of a skills inventory to help people recognize that even though they may not know very much about this particular situation, there may be actually things that they do know that apply that they may not recognize if they're only inside the decision itself.
And what I'm hearing from you is the value of taking that step back and being a little bit more meta in our care in terms of how do we approach care collaboratively and in partnership. And I find often the complex care programs, we have that opportunity a little bit more so than other specialists to be able to take a pause and talk about not only the clinical decision itself, but how we make decisions together, and having that opportunity to reflect both on our practice and also on the family's approach. So I think there's a really nice opportunity you're highlighting there.
Absolutely. Thanks.
One other thing that I pulled from the paper too was the comment on opportunities that team members have to connect families with other families who may have reflections on their experiences. And I think oftentimes there's an opportunity for improvement with just connecting with a family-led organization or support group, but also it was mentioned the value of speaking about how to put that in context and how to make sure that those connections are used in the most productive way for your child's unique situation. So I thought that was a really nice point as well.
I'm glad you highlighted that. That's kind of the meta theme of this paper, is like taking a step back, right? Because it's not enough to just say, here's another family, but helping the family actually take a second to think about what information am I trying to seek from this other family, and how am I going to contextualize that? Because that's what parents told us, was this really, all of it was about becoming more discerning. Learning that your first instinct or your first impression, that it's more complicated and that you can actually be more nuanced in your approach. Parents talked about, I learned to ask the opinion of the respirologist about this other issue. They would give me a different perspective that would help me then integrate what this other team member was saying. So again, this ability to sort of step outside of the decision itself and recognize that there's just Googling something, and there's having an approach to Googling something that allows you to be more precise and more likely to get better information. That's really what parents talked about. The skills were not themselves that complicated, but it was the learning about how to use and refine that skill that came with time that helped them feel like it was more effective.
And reflecting on, you're mentioning this new ability to discern and be more nuanced in how you approach things and integrate different perspectives from different places. And to me, though you're mentioning it for families, I think about that as we're developing our approach to training in complex care or training in navigating uncertainty. That's a lot of what we try to do to develop clinicians who are working on care teams where this is happening. So I feel like there's so much opportunity. We're all learning the same stuff about how to work together and provide the best care. So it seems like there's a lot of good takeaways from the conversations you've had.
I think the learnings, all of them intersect, right?
Mm-hmm.
Because we're all getting better at thinking about the process and not just reacting to the individual situation.
Mm-hmm. And you've spoken about this a little bit, but can you tell me about specific messages that you have for patients and families from your study?
Oh, I'm so glad you're asking me what parents should take away. Thinking about this study from my perspective as a palliative care pediatrician, one of the things we often say to families is, you can only make the best decision you can with the information you have at the time that you're making this decision. And I think one of the things I notice in what the parents are saying in this study is that they're coming to realize that. They're coming to understand that they don't necessarily have control over what happens. What they have control over is the process that they use to make the decision, the best decision that they can. And so I think that beginning to understand what for you as a parent are the steps that you can take as you face a difficult decision. What are the resources that you have? What are the skills that you have to feel like you've done as much as you can to know the information that you need to know and to make a decision that's really taking into account your child, your family's values, what might be medically helpful for your child, what might be helpful for other aspects of your child's life, and try to put all those pieces together. And recognizing that you can develop for yourself a specific process that you can use that then you can apply to other decision-making situations. Like that's kind of the big idea of what parents told us that they were doing.
I was wondering if maybe we can take a step back and speak a bit about your study team and how you were able to pull this study together across two centers. Qualitative studies are often limited to a single site. So I was wondering if you could talk about your study and what roles and skill sets were represented.
Oh, that's such a great question. So talking about the study team, the first thing I want to mention is that the lead author of the study, Melissa Finlay, did just a fantastic job. So she joined my lab as an undergraduate research summer student. And then when she graduated, I hired her and then asking her to work on the coding and the analysis. And then eventually the writing of this paper was one of the major tasks that she's done. And I couldn't be more proud of the work that she's done in making this study happen. And she's actually off to nursing school. So I'm really excited to see where Melissa goes. So other people on the team, we had a number of different disciplines represented. The primary coding team was actually Melissa, me, and another research assistant in my lab, Vishu Chakravarti. And then we had a small group that we did a lot of the early work with that included a parent and a complex care physician, so Francine Buchanan and Sanjay Mahant. And then we took the ideas as they developed back to a larger study team that included both a parent and a complex care doc from Alberta, the second site, as well as a senior methodologist that does qualitative work, and a nurse researcher in palliative care, and an NP in complex care as well. So it was a really diverse team, and it was so interesting to see how everybody's different lens really helped us look at what parents were saying and to try to integrate it both from the perspective of parents and then the way clinicians understood what the parents were saying.
That's been something that we've been noticing as we've been doing this podcast, is that more and more people are including family leaders and partners on the study team. We're seeing them represented in authorship. I think there's an increasing recognition of including patient and public involvement as a structured part of studies. So I'm curious, you mentioned you had a few parent partners on your team. Can you tell me about contributions or ways that the study may have been shaped differently because of their involvement?
I have to shout out Francine Buchanan, who's the qualitative researcher in parent and parent in research engagement expert, because she just basically transformed my way of thinking about the importance of engagement. I didn't have any family engagement as part of my PhD. And then this was kind of the first big project I put together. And so I reached out to Francine because I knew that we shared an interest in shared decision making. And I thought that there would be real synergy between the parent perspective, where she had this dual hat of a parent and a researcher, and the clinician's perspective. I can't even articulate exactly what her contribution was, except to say that we couldn't have done the study. It really required both of our perspectives. She was integral to the thinking through. I just this morning looked back at our email exchange from 2020, and like I can see it from our first emails, the way in which we were both applying our own lenses and then putting them together to make the study better. So I wouldn't have asked the questions the way I did. I don't think I would have even asked the question itself if it hadn't been for our conversations and for the synergy that came from our different perspectives. And then I have to say that, like, since that study, with Francine's help, I created a parent advisory committee for my lab itself. I meet with them multiple times a year. They weigh in on all of my new ideas at the time when they're most shiftable, is the most value that they add. And I can't even imagine doing the work that I do without input from parent partners. It's just been transformational.
Thank you for sharing that impact on you as a researcher personally. That's really wonderful to hear. Were there any other opportunities or challenges that you identified while developing and conducting the study?
We wrote the grant for the study during high COVID, and then started recruiting the study during COVID itself. So all the interviews were virtual, and there are complications, of course, with the usual challenges of doing patient-facing research, I think, applied. I would say that I had a really fantastic peer review experience from this paper, which I've never highlighted before, and I wouldn't have expected to talk about this in an interview. But we had this reviewer from the JPSM who was just fantastic and really changed in concrete ways the whole paper. Like, we took it down to the studs and rebuilt it because of the feedback from this individual. And it's so much better because of that person. And I don't think as a scientist I'd realized the degree to which a peer review could be so helpful. And it's really shifted the way that I think about my peer reviews. It was so generous. Whoever this was invested so much time in really thinking deeply, I think saw value in this paper and like how we could make this paper the best paper possible. So that was the other thing I think I learned from this experience.
We don't talk enough about the role of the peer review process, and this is a nice shout out too for members of our community to get involved in peer review. And really, it's a service to the community to ensure that there's clear description and approaches to analysis and ways that we can make sure what we're disseminating is of the highest quality. Thank you for sharing that. Do you have any other advice or lessons learned for other researchers in the field?
I'm now a huge proponent of family engagement. And I think that connecting with a family engagement person at your institution, if you're doing a project and saying, like, how can I get parents involved from the ground up? And I would also say, not just once you've already are putting together the study team, but how can you have parent input on the idea itself before it's even coalesced? I can think of a number of examples of work I've done since this, that we've shifted entire study questions, we've shifted methods, made major changes at the very beginning of the study because of the input of our parent partners.
What do you think are important next steps from your work?
I have started this process with Courageous Parents Network, who I know this podcast is familiar with, the work of Jennifer Seidman and Blythe Lord and the rest of the crew at CPN. And they approached me and asked if we could think about how to teach parents about shared decision-making. That was an interesting question to me as a scientist and as a collaborator with them, like together. We tried to work on how to help parents understand the process of shared decision-making in a general way, so that when they're in it, they have a better sense of how to navigate that process. So that's been really fun. And I think that grows from this work in that idea that we don't spend enough time talking about process. And if there's a way that we can help generalize the steps of a shared decision-making process, which are hard to generalize, right? Because all of them are so individually driven, but figuring out what are the ways that you can help build that partnership, help parents recognize why a clinician may be wanting to engage with them in a particular way, and helping through education to help that process go better.
That's really exciting. One of the things that I've been interested in is how, if there is something that we'd like to see in practice, having that mirrored in training, and are there opportunities for clinicians and families to learn together about shared decision-making?
Absolutely. No, that would be really interesting.
Well, thank you so much for your time, Kate, and thank you to you and your team for advancing the field of complex care. And thank you for listening to the Complex Care Journal Club podcast. We aim to highlight research that has the potential to be practice-changing, that values patient and family engagement, is relevant across disciplines and diagnoses, and uses high-quality or novel research methods. We invite you to join the conversation by suggesting an article that you would like to see discussed in this podcast using the form provided on the OPENPediatrics YouTube channel. Thank you for joining us.